Welcome to Alfaisal University Clinical Skills Center. Today we'll be demonstrating to you the simple and widely used technique of interrupted suturing of the skin. But before we begin, let me introduce to you my team. Dr. Mustafa Obedat, who is there to record the proceedings of this session. Dr. Luqman Anwar, who will be assisting me and narrating to you the steps of the procedure as it goes. So now let me show you the area. The suturing should be done at a sterile area, usually a dedicated area where the minor procedures are done. Over there we have the surgeon who is tying the knots and doing the suturing should be appropriately gowned and gloved, sterile area, and then everything should be appropriately decontaminated, and the aseptic precautions should have been taken care of. Now let me show you. This is our model of the incision. You could see there are a few incisions here. For demonstration of the technique, I will keep it in such a way that there is a proximal flap of the wound and then there is a distal flap of the wound, and this is applicable to all of them. Then let me show you the instruments. This is the typical instruments required for this whole procedure. This is a typical needle holding forceps, which has got a lock and the end where we could hold the needle with suture. This is the tissue forceps, which has got a tooth at these ends to hold tight. We sometimes need it, not necessary to use it all the time, but sometimes we really need it. This is a plain tissue forceps without a tooth at the terminal end. Usually, most of the times we use this one, and we will use this one in this demonstration as well. This is a typical suture cutting scissors, and sometimes we need a even sharper cutting tool like a scalpel, which is demonstrated here, which is shown to you. And for this demonstration, we will use the polypropylene 2-0 suture, commonly known as the Proline 2-0, and this will be with us in the instrument box. So let's put them back. Now for the demonstration, we need to clean the area ideally, and then once the area is draped, and then we would have our needle holding forceps, and this is our suture. So we will open this up. It's a pretty long thread. We should hold it in such a way that a junction of proximal 1/3 and a distal 2/3, at a junction of proximal 1/3 and a distal 2/3, it should be held by the needle holding forceps like this. Now I will just demonstrate the one typical suture, typical interrupted suture to you. We need basically these two instruments. One is the needle holding forceps with a suture already with it, and here is our skin or tissue holding forceps. Now we should start from one of the ends of the usually. Well, it depends on the surgeon's habit, but usually if I'm a right-handed person, I will start from the extreme left side and then suture down the line over here until the incision is fully covered. and we should well, let me put it this way so that I could be easily demonstrated. We should insert the needle leaving an edge of around 3 to 5 millimeters at the very proximal end, like this. Turn it all the way through the skin from and then into the subcutaneous tissue. Then drive it towards the opposite side. Similarly, hold it again. The same way. Oops. Here you go. So once you are now you leave a short length of the thread, and then keep the instrument in the middle like that. One loop, the second loop, hold to the end, and then tighten the knot. So this is how the first knot is furnished with double loop. Now again, the instrument in the middle, here onwards we will have a single loop rather than double. Hold it. The second loop, the second knot as part of the complete knot. Now again in the middle, single loop. For the sake of demonstration, I will be a bit more, tilted this way, and here you go. So with this, we completed 3 knots, which will together make a single knot. Otherwise, the knot will not be tight and could, open loose. And now we could either use a scalpel or the scissors to cut the remaining thread. And here you have one interrupted suture furnished. Thank you very much. And once we are done with the whole wound, then we will discard the sharps and everything, all the leftover into the appropriate boxes. For example, this is a sharps container, so we'll just throw this away into the sharp and dispose it off appropriately, and then send the remaining instruments, if they are to be sterilized, to the sterilizing unit. Thank you very much.